Mr. Johnson.
Thank you, Mr. Chairman, and thanks to our panelists for being with us today. Dr. Walensky, thank you especially for being here. You got a tough job. CDC has got a tough job. And public trust and confidence in what the organization does is so vitally important, and I know you know that. In the American Rescue Plan passed almost unilaterally by our Democrat colleagues, it included a staggering $47.8 billion of new spending for, quote, activities to detect, diagnose, trace, and monitor SARS-CoV-2 and COVID-19 infections and related strategies to mitigate the spread of COVID-19. In addition, that law provided CDC $1 billion for, quote, vaccine confidence activities. Would you say the $1 billion for vaccine confidence activities was successful in building confidence in the vaccines?
Thank you for that question. I think that what we don't know is what would have happened in the absence of those resources.
No, but do you think it helped in instilling confidence?
I absolutely know that we have been using those resources.
No, but did it improve the confidence level of the public? That's what I'm asking you, yes or no.
Compared to where it otherwise would have been in the absence of it, yes.
Okay.
But we
all right.
also
well,
have
I'm
a
not sure that we got our money's worth, because in my district, people tell me not only are they losing confidence in the COVID vaccines, but now other more proven vaccines as well. We're going backwards. A recent study showed that from 2019 to 2022, the percentage of American parents who oppose requiring the measles, mumps, rubella vaccines for school jumped from 23% to 35%. This is dangerous, and it's because people do not know who to trust. There is a crisis of confidence in our public health authorities, including the CDC, after a series of major missteps in the last couple of years. This is exactly why we need to have this hearing today. So, Dr. Walensky, continuing on, do you know how much funding the American Rescue Plan gave CDC to conduct or to support contact tracing activities?
I would have to get back with you to have that specific number.
Do you know how much money from the recent omnibus does the CDC plan to spend on contact tracing activities?
I would have to get back with you on that specific number. We're no longer endorsing contact tracing specifically for COVID-19.
Okay, do you know how much was provided for staffing?
Again, I won't be able to give you specific numbers on any of these, but I'd be happy to work with your staff to do so.
Okay, I'd appreciate it if you would get back to me on that. Then is it fair to say that the CDC has, through grants, technical assistance, and research, spent billions of dollars over the course of the COVID-19 pandemic on supporting contact tracing activities?
Again, I don't know the specific number off the top of my head, but what I would say is it's contact tracing, mitigation, testing,
It's been allocated
outreach.
though, right? Contact tracing, billions has been allocated and approved to the CDC for that purpose.
I would need to get back to you specifically on the line items.
What is your contact tracing staff doing now?
Well, I'm not sure that we have contact tracing specific staff.
That
at
answers my
CDC.
next question.
Well, I do want to say, though, that we had 2,500 people deployed who had, into our response, who had full-time previous
Well,
jobs.
you kind of answered my next question. I asked this because I was surprised to find out that as of last Friday, the CDC's contact tracing website hasn't been updated since February of 2022 during the Omicron surge. The CDC has not changed or updated its guidance in a year. Adding insult to injury, there is a notice on the contact tracing webpage stating that, quote, CDC is reviewing this page to align with updated guidance. This notice has been on the website since August 11th, 2022. This means the CDC's contact tracing guidance has been undergoing alignment for 181 days. And Mr. Chairman, I would ask unanimous consent to put these website documents into the record. So when we talk about CDC losing its credibility, it's things like this. CDC and its supporters argued as recently as December 2022 that it needed billions of dollars for, among other activities, contact tracing. But the CDC can't even be bothered to update its public-facing guidance in a timely fashion. Public confidence and public trust is important. Dr. Walensky. Thank you, and I yield back, Mr. Chairman.